Hello and welcome back to A Better World. This is your host, Mitchell J. Rabin, and we're very glad that you're joining us again today. Today we are on location in Sausalito, where we have the great privilege of interviewing Burton Goldberg. Burton is very well known for his work as a medical journalist, and you could say blowing the whistle on the allopathic medical industry in very powerful work that he has put together. Alternative Medicine, The Definitive Guide, a book on headaches, and a book on cancer most recently. This has really been taking the world by storm. We're very pleased that he's with us today. He's going to be going into some details about the importance of taking control of our own health and how we can go about doing that. So Burton.
Good day.
Good day. Pleasure to have you.
Thank you.
Yes. First of all, tell us a little bit about your background and how it is you got into this field of all possible fields.
I got into alternative medicine about 25 years ago when my friend's daughter, in a fit of depression, attempted suicide by slicing her wrist at the age of 19. She was going to a psychiatrist and frankly being talked to death, when a holistic physician discovered she was hypoglycemic. She was schizophrenic, she was depressed, she had anxiety, a wreck.
Yep.
It's
very common.
He treated her with diet and nutrients, and this young girl got well. And that's how I got into alternative medicine 24 years ago. I was a restaurateur, I was a builder, developer, a hotelier. I had no concept of medicine. And when I discovered that there was a whole world that was being suppressed called alternative medicine, I started.
That's all you needed.
I had to study it.
Yeah.
Why, I don't know. And when I discovered what caused heart disease, and it was being suppressed, and how heart disease can be avoided and prevented and reversed, and how cancer can be reversed, I started studying. And finally I did the big silver book, Alternative Medicine, The Definitive Guide, that covers 50 different therapies, because that's what alternative medicine is. It's a catch-all phrase for 50 different therapies and how the physicians who practice these therapies successfully reverse 208 of the worst health conditions, from cancer, arthritis, bedwetting, arthritis, back pain, chronic fatigue, headaches.
All the things that standard Western medicine really throw their hands up in the air with, because they cannot do anything about them.
When it comes to the emergency room, you can't beat mainstream medicine. They're the best. They sew you up, they take away your pain, they keep you
Microsurgery is
alive.
phenomenal. Yeah.
Some of the operations are extraordinary, 80% of which can be avoided and prevented.
Anyway, that's right.
But they're the best medicine. But remember, detach that from degenerative disease, because we still have back pain, headaches, chronic fatigue, and arthritis. They don't have the foggiest. My last book on cancer, The Alternative Medicine, The Definitive Guide for Cancer. And incidentally, anyone out there who knows somebody with cancer, call them now and tell them to tune into this show, because you are going to hear things that you have never heard before that will save your life. I promise you.
Well, without further ado, let's go into where it's deepest and darkest, because it's in the area, especially of cancer, that most of those secrets have been kept.
I did this book with Lee Cowden, an MD from Dallas, Texas, and John Diamond from Reno, Nevada. These are MDs. And the doctors in alternative medicine got into alternative medicine because they or someone in their family were not helped by mainstream medicine. So they had to go outside the box for help. They're traditionally trained, but they knew something was rotten in Denmark. And they turned to alternative medicine, and they finally learned from their brothers and for experience. The bottom line is this, that our doctors rarely use chemotherapy, radiation, and surgery, where your hair falls out, your teeth get bloody and loose, and then you vomit all over yourself. Our doctors have a 180-degree different approach. And the book I did is called Alternative Medicine, The Definitive Guide to Cancer. 1,100 pages. I cover 85 doctors and 37 in great detail.
What are the actual statistics, Burton, of the effectiveness of chemoradiation?
Well, let's take radiation. It's like being 2 miles from the atomic bomb. They hope that you survive
Right.
the toxic
They
radiation.
kill all the tissue in the whole area.
And not only that, Dr. Goffman, who was kicked off the Atomic Energy Commission, Commission, says that radiation causes cancer. The mammograms that everybody is looking for, early detection, these rads bioaccumulate. And that's why in Long Island and Connecticut you have this extraordinary high rate. 1 in 7 women will have cancer.
Breast cancer.
1 in 8 women will have breast cancer in the United States. Now I'm going to give you some figures that are terribly shocking. In 1960, that number was 1 in 14. In 1950, that number was 1 in 20. And in 1900, 1 in 33 men, women, or children had cancer of any kind, shape, or form. Nobody is talking about this. Why do we have this epidemic? Breast cancer alone is escalating. We're talking about breast cancer now at 1.3% a year. Now that's epidemic, and no one's talking about it. The doctors in my book do talk about it. They cover all cancers. I have Dr. Schechter in Suffern, New York, Dr. Atkins in New York City, Dr. Simone in New Jersey. I have in Tucson, Arizona, I have Dr. Jesse Stoff, an MD, who has a Solstice clinic. And these doctors tell you how they do it. And here's how they do it. It's 180-degree different. They go to the cause. Now, the other day in Orange County, California, I did a television show with Dr. Garrett. She's a surgeon. And she was wearing that beautiful pink ribbon for breast cancer. And before we went on the air and we debated, I said, Dr. Garrett, what causes breast cancer? And she said, I don't know, and I don't think anyone knows. I was appalled. I said, Dr. Garrett, in chapter 25 of my book, we have 33 causes of cancer. These are major categories. There's hundreds, but these are the categories. Pesticides, herbicides, heavy metals, dentistry, feng shui, the Chinese, the mercury, sunshine. Oh, we go on and on.
Lack of?
No.
Or too much? Excess?
Well, it's basically excessive melanoma, the skin cancer. They don't know.
Emotional factors. Many environmental factors, electromagnetic fields.
Excellent. Absolutely. Emotional, toxic emotions.
Of course.
Big
now,
time.
What are the
minute you're told you have cancer, you have toxic emotions.
Well, this happened recently to someone I know who was told that she had ovarian cancer and went into the normal emotional reaction of being told that you've basically been given a death sentence.
Your T cells go in the basement.
Instantly. The fact is that she didn't have the cancer, which she discovered only a couple of weeks later when she insisted upon getting a second opinion, which her doctor did not want her to do, but to have her ovaries removed right away. She refused. She got the second opinion, found out that the blood work was wrong. She didn't have cancer at all. And she made a full rebound. But can you imagine? She's going to live with that for the rest of her life. I think doctors ought to be, this is criminal behavior. Just in itself.
Well,
but tell me this, would you please, because I know you have access to these statistics that I don't have at my fingertips. What is the actual cure rate, so to speak, of the use of chemotherapy? And I ask that is because this is what the doctors are always prescribing.
Absolutely. The actual results with chemotherapy, and by the way, there are no double-blind studies that they bring to alternative medicine as the capital way of doing things.
Yeah.
7% of chemotherapy works.
7%?
This is a German study. 15% live longer, and the balance go down the tube. Now, in my book, Alternative Medicine, A Definitive Guide to Cancer, I have Dr. Nagorny. Because if you decide that you are going to go conventionally, Dr. Nagorny is an oncologist. He takes the biopsy, the piece of tissue, of meat, puts it in a test tube, and tells you which chemotherapeutic agents will work on your tumor. Because many of them only work in 20% of the cases,
Yes.
and you're vomiting and losing your hair for nothing.
So at least it's bio-individual.
Well, that is alternative medicine. Your cancer, even with the same diagnosis, is different than Sally's cancer.
Sure.
Your causes may be very well different. That's why each case is
But at
individually
least what you're
handled.
suggesting, Burton, is that he is making some distinctions between different chemotherapeutic agents per person, as opposed to just the blanket effect.
And so he puts this biopsy tissue in a test tube and will tell you which chemotherapeutic agents, maybe more than one, will work on your tumor so you're not vomiting and losing your hair for nothing. And then he'll also tell you which antioxidant and nutritional supplements will overcome the side effect of that tumor. Now, isn't that amazing? Now, many of our doctors will use low-dose chemotherapy, which is far more effective, even in medical studies, and yet ignored by mainstream medicine. Alternative medicine has a 180-degree different approach. Go to the cause, remove it, and then feed the immune system absorbable nutrients. And guess what happens? Your God-given immune system kicks in and heals you.
That's right.
That's what alternative medicine is about. Whether
That's
it's
right.
heart disease, and remember this, if you're not happy with the medicine you're getting, look at alternative medicine for options. Look at the options available because it works.
Let me tell you, this audience is extremely hip. They've been hanging out with me for a few years. They know the truth about this situation. What I'd like you to do, if you would, is tell them what you think of all of your experience, which is very, very wide and deep at this point. What do you find as the most effective treatments for cancer among them all?
Well, every doctor has their...
And now I believe and accept the notion of bioindividuality, so I know it's difficult to generalize. But what
basically,
are the basic notions that come
the
to
number
you?
one thing is you got to detox the body. Now, there's many methods of chelating or pulling out the poisons.
Sure.
First of all, how do our doctors know there are poisons in the body? We have a microscope called dark field that does not kill the blood, that you can see aberrant blood many years before you have the
the disease.
The disease.
Exactly. It shows the precursor.
It shows the precursors and things
live
you
blood
can do.
cell analysis. Sure.
They also have electrodermal screening, where they use the meridian system of the Chinese. Been around 4,000 years. There's no new age airy-fairy
That's
concept.
right.
The meridian system is totally ignored by mainstream medicine. It's been charted by the French and Koreans with isotopes. They know it exists.
That's
and
right.
you're an acupuncturist,
That's right.
and of course, that's how you use it.
That's right.
Now, some of the schools will teach acupuncture. There are now 50 medical schools that teach some cursory course in alternative medicine. There's 150 altogether. But they don't teach the doctors going through that don't take acupuncture that there is such a river of energy. And our doctors use
This is so important.
electrodermal screening. You hold an electrode in your hand. It charges your body with a trickle of electricity. Then you test the acupuncture points. You can even tell which ventricle in the heart is malfunctioning. They'll tell you which organs have got disease, and they'll tell you what the disease is and what the poisons are in your system, so that you can make a homeopathic dose or an herbal remedy or an Ayurvedic situation.
And
a Chinese
detoxify
herbal.
properly.
Pull out the poisons. Then invigorate the body with nutrition, because that's what it's all about. Mainstream medicine ignores it. They send you to the hospital. They do surgery. They pay no attention to the lymph system, which is your garbage system in the body. And the lymph system is the seat of your immune system. It starts in the small intestines and goes all through the body. It works automatically. They ignore it. They are ignorant. As a matter of fact, I think they kill more people than Hitler, the oncologist of America. They killed my mother, and they killed my sister, 2 years younger than I. I'm 70 years old. And I devote my life to this because I have 3 children. One of them is 9 years old, one is 46 and 42. I have 4 grandchildren. And the bottom line, folks, is this: that unless we change the way we eat, drink, and breathe, we are the endangered species. Americans are being poisoned to death with pesticides, herbicides, and heavy metals. The other aspect that is very important
And
for you to know,
change the way we think also.
mental plays an enormous role. But remember this, we had a lot of aggravation. We worked 6 days a week. We worked 12 hours a day in the 1900s. We had to climb many stairs. They didn't have the elevators.
I hear
They didn't have the heating. And
This is true,
there
too.
wasn't anything like the cancer. And well, they'll say, well, but we're living longer. And we have, it's a disease of the aged. You bioaccumulate these problems. When I was born in 1926, cancer was the 10th cause of death in children, accidents being one. Today, cancer is the second cause of death in children. So it's not only...
Second?
Yeah. We are an endangered species. This is no dress rehearsal. Why else? If I asked everyone in the audience to raise your hand if you knew somebody with cancer, many people would raise 2 hands, and 3 hands, and 4 hands, depending on the age group and the milieu that you work amongst.
Mm-hmm.
It's a very serious situation, and anyone with cancer must get my book, Alternative Medicine, The Definitive Guide to Cancer, written by Dr. Cowden, Dr. Diamond, and myself. Took 3 years, and we have 37 doctors in great detail, the substances they use, and dentistry plays a role.
Do you have case histories of there?
Well, let me give you Dr. Rao in Switzerland. Dr. Rao, and most of
great.
our doctors in the United States, but Dr. Rao in Switzerland finds that 90 to 95% of his breast cancer patients have a dental involvement. Now, the dentistry comprises many components. You've all heard about the mercury
He was
situation.
just teaching here in Arizona, as a matter of fact. Yeah.
Yes, indeed.
Yeah.
Dr. Rao was interviewed by us. We have a magazine now on the newsstand, and then it's called Alternative Medicine Digest, and it's a magazine with stars on the cover. I have let's see, Judith Light, an actress, on the cover. I had Ed McMahon. I had just so many
wonderful.
people.
If people want to get your books or the newsletter, you have an 800 number.
It's not a newsletter, it's a magazine that you can buy on the newsstand or get a subscription. We have a number 800.
Why don't you give it
800-333-HEAL or 800-333-4325. Our office is in California, so you'll use California hours from 7 in the morning. And if you need information, they'll give it to you. But
Right.
we have it in every bookstore, Barnes and Nobles and Borders, and all the a lot of the independents have the Alternative Medicine Definitive Guide, where we cover 50 therapies and 208 of the worst health conditions. Then we have the Alternative Medicine Definitive Guide to Headaches by Robert Milne, an MD from Las Vegas, who got into alternative medicine 13 years ago when his daughter was born. And she had colic. And he went to his professor, he had just graduated out of a university. And he said, and nothing worked. The child was screaming all night. So he went to the library and he found a book on homeopathy. And he looked up colic and he matched the substances to the child's condition.
Yeah.
Gone was her colic within hours. The child slept and he became an alternative doctor. And that's how our doctors get involved in alternative medicine.
Because it works.
Alternative medicine uses non-toxic, inexpensive substances. And you'll hear a lot of people say it's anecdotal, there's no history, and this and that and so forth. Because you got many people tuning in here who are clicking and surfing. And when something is as important as cancer, they're going to stop and listen because we all know that it's a death sentence. Right. You know, we're really fearful, and they're right. The way mainstream medicine works, but the way alternative medicine works, it is reversible. And that's what our book is about. All cancers are reversible. And ladies and gentlemen, I'm going to tell you something.
You heard it here, folks. You heard it here.
Almost preposterous. I have many of our oncologists, Dr. Speckhart in Virginia, an MD oncologist. I have Lee Cowden in Texas. Stage 4, end-stage cancers, they have an 80% chance of reversing it. And it all depends on the patient's compliance and their mental attitude and their desire to get well. Some people give up.
Sure. Go back to Dr. Rao.
Dr. Rao said that 90 to 95% of his breast cancer patients have a dental involvement. Now, if
Can you
you're...
explain what that means?
That means that there's an infection under the gum. Very good. Under the gum that may, because the meridian system connects the teeth to every organ and system in the body. It goes through the mammary glands, or breast. It goes through the stomach,
testicles,
into
prostate.
the ovaries and the prostate. I'll never forget a case in Arizona, in Scottsdale, where this man had excruciating pain in the prostate from cancer. The electric dermal screening device indicated that he had an infection under the gum. The dentist removed the tooth. The instant the tooth was removed, his pain disappeared. So that shows you that the knee bone is connected to the head bone. Remember this, the body is one. In alternative medicine, we don't have eye doctors and cardiologists and foot doctors and belly button doctors. Our doctors have to know the whole body. They pay attention to the liver. They pay attention to the kidney. They pay attention to
It's
the
truly
pancreas.
holistic.
They clean the body, and because the liver cleans the blood.
It cleanses the
And they-
sure.
and
So it's
you know-
important to keep the liver very clean.
The famous sayings, we got it all, and then 4 years later, or 2 years later, or 6 months later,
Oh.
there's another cancer. It's the same cancer. They haven't gone to the milieu. From the rib cage down to the groin is where all disease starts.
Burton, remember this. When you go out to prune a tree or a bush and you cut it back, what happens?
It regrows.
That's right. Even
Regenerates.
faster and more, which is why you prune it in the first place.
Good point.
What do you do when you do surgery and cut out cancer?
You spread it.
That's exactly right.
And so if our
And
doctors...
it is proven that this is the case.
But I must say that many of our doctors will do excising of tumors of the breast or wherever if it's too large, but they'll encapsulate it first so that it doesn't spread through the body. It doesn't go in. Mainstream medicine ignores the lymph system, the garbage removal.
there's another
The only
point.
thing they do is excise it. They cut it out. Our doctors know how to liquefy it with the light beam generator,
Sure.
with trampoline,
Right,
rebounding
lymphocyzing, rebounding. But you see, even more important, if I may say, is that it is recognized that whatever was going on in the body, usually for years of toxifying and toxifying and toxifying, is what creates a carcinogenic condition.
All right, we
so
must-
you must change the terrain of the body. It's not just pulling out tumors. That's not the answer to the cancer problem.
Where is the poisons coming from? Our water, the fluoride.
That's right.
They just had a study with the FDA telling kids not to swallow toothpaste. How can you dare put fluoride in your
my
child's toothpaste?
word.
And how can you dare put chlorine in the water because it causes trihalomethanes, which is a deadly toxin? Where does the poison come from?
That's right.
We send DDT down to Central America. They spray it on our coffee crop. It goes into the soil, up through the
That's right.
roots, into the stem, into the beans, and we sip it microbit by microbit.
And then they sell it back to us, right? So
But even the poisons and the pesticides we use in our own country, microbit by microbit.
let me ask you this. You have put together a formidable body of information. You have gotten some of the top level MDs who have dared to get involved.
380 of them.
God bless you. You are doing fabulous work. Now, with this armamentarium, if you will, are you going to medical schools or to other standard allopathic doctors? Because if anyone's qualified to do it, because we don't want a war, we actually really want to educate these doctors so they come around and see the light of day.
Niels Bohr.
You're the one who's really qualified to do this.
Yeah, Niels Bohr, the physicist, says science advances funeral by funeral. So you're going to find very few coming aboard because how dare you prove me wrong? I've been hurting people all these years.
And getting handsomely paid for it.
You better believe it. In heart disease, they do open heart surgery, a total waste of time. 90% of them are a waste of time according to the United States government, but that's another subject.
Yes.
The point is, when we feed our animals pesticides and herbicides in their feed, it goes into their fat, and when we consume the animal, it comes into our fat, and that's how we imbibe and how we receive these poisons.
That's the truth. So, what's our solution?
Solution is to arm yourself with this information. You, as caregivers of your loved ones, your older ones, and your younger ones, must educate yourself as to what's going on. Otherwise, you too will become a statistic, as your friends are. There's an epidemic out there, and we will tell you what causes it, how to avoid it, how to reverse it, how to prevent it. It's up to you to pay attention. The media, unlike this, where it's open to the public, the media takes ads from the pharmaceutical companies. They don't want you to know this information. Sloan Kettering doesn't want you to know this. They want you to poison you with pesticide, with chemotherapy and radiation and surgery. They don't want you to know this information.
Look at what happened with Royal Rife back in the 1930s. I mean, if that's not a case history to tell,
You have it going on now. We had Sloan Kettering do studies with hydrogen sulfate, which is a very inexpensive product that helps in many cases and not a cure. Remember, there are no magic bullets. Multi-therapy, multi-substances. In the book, we have 200 of them, from 714X to Ukraine, to herbs and homeopathics. Everything is reversible with alternative medicine. Learn about your options.
Let's keep it from being an alternative. Let's make it, that's what should be mainstream, right?
There are very few doctors who practice holistic medicine in cancer. So I want you to shop a doctor as you would a used car with great caution. Doctor, who have you treated with my condition, and may I speak to some of the patients? I just came back from the Dominican Republic where there's a clinic that kills cancer cells. They don't know anything about detoxifying and dentistry or any of the other problems that are involved. They kill cancer cells. It is miraculous. I've seen glioblastomas where they gave a month to 3 months to live. Go home and settle your affair. You're going to die. Cleaned up. Amazing. I had a friend of mine's daughter go to Mount Sinai in New York with ovarian cancer, 20% chance of recovery. Killed her cancer completely. And then she has to detoxify and go to one of the clinics or physicians that can help her.
See, she's got to. First of all, thank God for that. I'm very pleased. Yet, the conditions that created the cancer in the first place are still in place.
Right. You see what he just said? You've got to go to the cause and remove it, and then feed the body. Just killing that tumor doesn't do it.
It's not an answer.
You got to change the milieu or the terrain or what caused it. We know what causes it. We'll tell you in this book. You'll be able to select the kind of physician you want. And basically, as caregivers, learn the information so you can prevent it happening in your family.
This is a message that everyone needs to hear, Burton, really.
And no one's talking about it.
That's
right. Why this is
not enough people are. And we have you to thank largely for the great and pioneering and courageous work you're doing.
Thank you.
Really. Who's willing to stand up to the medical community? Because it is genocidal. It's really genocidal. I have come
medieval
to that point of view.
Medieval.
It really is. So, when you're in New York, will you come on the show again and continue this?
Love it. Let's stay in touch.
Great. Really a pleasure to have you on the show.
And God bless everyone out there.
Great. Give your 800 number again.
800-333-4325.
Or 333-HEAL?
333-HEAL. H-E-A-L.
Beautiful. Thanks so much for joining us again. This is your host, Mitchell J. Rabin. You can contact me at 212-420-0800 and share with me your thoughts and feelings. I love hearing from you. And we look forward to seeing you next week.